Jake Morrison had been a paramedic with Denver Fire Department for 12 years. He'd seen everything: car accidents, heart attacks, overdoses, strokes, violent crimes. After 12 years, very little surprised him anymore. It was a Wednesday evening, 7:43 p.m. when the call came through. Rescue 17. Respond to 2847 Maple Street for a pediatric injury. 7-year-old female. Fall downstairs, conscious and breathing. Father on scene. Jake and his partner, Maria Santos, climbed into the ambulance and headed to the address. Pediatric calls were always concerning. Kids were fragile, injuries could be deceptive, and parents were often panicked and emotional. They arrived at a modest 2-story house in a quiet suburban neighborhood. A man in his mid-30s met them at the door, looking appropriately worried. "Thank God you're here. My daughter fell down the stairs. I think she might have broken something." Jake grabbed the medical bag and followed the man. Brian Foster. He said his name was upstairs to a small bedroom. A little girl sat on the bed, crying quietly, holding her left arm at an awkward angle. "Hi, sweetheart," Jake said gently, kneeling to be at her eye level. "My name is Jake. I'm a paramedic. That means I help people who are hurt. Can you tell me your name?" "Emma," the girl whispered, not making eye contact. "That's a beautiful name, Emma. Can you tell me what happened?" Before Emma could answer, her father jumped in. "She was running on the stairs even though I've told her a million times not to. She tripped and fell down about 6 steps, landed on her arm. I heard the crash and found her at the bottom." Jake nodded but continued addressing Emma. "Emma, does your arm hurt?" She nodded, tears streaming down her face. "Okay, I'm going to look at it very carefully. I'll try not to hurt you, but if something hurts, you tell me, okay?" Jake gently examined Emma's arm. It was clearly fractured, likely her radius based on the angle and swelling. But as he examined her, he noticed other things. Bruises on her upper arms that looked like finger marks. An older bruise on her cheek, yellowing and fading. When he gently lifted her pajama sleeve to examine the injured arm, he saw what looked like burn marks on her shoulder. Small, circular, consistent with cigarette burns. Jake's training kicked in immediately. He'd completed specialized training in recognizing child abuse indicators. These injuries, the pattern of bruises, the burns, the fracture, they didn't match the fell downstairs story. They suggested something much worse. Maria caught Jake's eye. She'd seen it too. They'd worked together for 5 years and had developed a shorthand for concerning situations. Maria gave a tiny nod. She was thinking the same thing Jake was. "Mr. Foster, we're going to need to take Emma to the hospital to get x-rays of her arm," Jake said. "It's definitely broken and needs to be set." "Of course, whatever she needs. Can I ride with her?" "Absolutely. Let me just get her stabilized and comfortable for transport." Jake carefully splinted Emma's arm while Maria prepared the stretcher. Brian Foster hovered nearby, watching everything they did. As they loaded Emma into the ambulance, Jake made a decision. "Mr. Foster, would you mind riding up front with Maria? I need room to monitor Emma in the back, and there's really only space for one adult back here." Brian looked like he wanted to object but nodded. "Okay, but take care of my little girl." "That's exactly what I'm going to do," Jake said. Once the ambulance was moving, and Brian was separated from Emma by the partition between the driver's compartment and the patient area, Jake leaned close to Emma. "Emma, sweetheart, I need to ask you something very important, and I need you to tell me the truth, okay? You're not going to get in trouble, I promise. Did you really fall down the stairs?" Emma's eyes filled with fresh tears. She glanced toward the front of the ambulance where her father was, then back at Jake. She shook her head slightly. "Can you tell me what really happened?" Emma's voice was barely a whisper. "Daddy got mad. He pushed me. I hit the wall. My arm hurt so bad. And he said if I told anyone what really happened, he'd what, Emma? He'd kill Mommy." Emma started sobbing. "Please don't tell him I told you. Please. He'll hurt Mommy. He said he'd kill her if I ever told anyone what he does." Jake felt cold fury rising but kept his voice gentle and calm. "Emma, where is your mommy?" "She's at work. She works nights. Daddy he only does bad things when she's not home." "What kind of bad things?" Emma pulled up her pajama sleeve, showing the cigarette burns Jake had noticed earlier. "He burns me with his cigarettes when I'm bad. He hits me. He pushes me. He locks me in the closet. He says I'm a mistake, that he never wanted me, that I ruined his life." Jake's hands were shaking as he documented everything Emma was saying. "Emma, you are so brave for telling me this. You did the right thing, and I promise you, I'm going to make sure you're safe. Your daddy is never going to hurt you again, but he said he'd kill Mommy if I told. We're going to protect your mommy too, I promise. The police are going to help. But Emma, I need you to do something for me. When we get to the hospital, your daddy is going to be there. He's going to ask you what we talked about. Can you tell him we just talked about your arm? That we talked about how brave you are? Don't tell him you told me the truth. Can you do that?" Emma nodded, still crying. Jake signaled to Maria through the partition. She understood immediately. Something was seriously wrong. She radioed ahead to the hospital, using code phrases that indicated they were bringing in a suspected abuse case. She also quietly called dispatch and requested police response to meet them at the emergency room. The ambulance ride to Denver General took 15 minutes. Jake spent the time gaining Emma's trust, documenting her injuries with photos, standard protocol for suspected abuse, and preparing himself for what came next. At the hospital, Brian Foster climbed out of the front seat and tried to follow the gurney as they wheeled Emma inside. Jake blocked his path subtly but firmly. "Mr. Foster, I need you to wait in the waiting room while we get Emma checked in and assessed. There's paperwork you'll need to fill out at registration. I want to be with my daughter." "I understand, but hospital protocol requires registration first. Someone will come get you once Emma is settled." Brian looked frustrated but couldn't really object without causing a scene. He headed toward registration, while Jake and Maria wheeled Emma into a trauma bay where Dr. Patricia Lee was waiting. "We have a 7-year-old female with fractured left radius," Jake said formally. Then quietly, he added, "Suspected abuse. Multiple concerning injuries inconsistent with stated mechanism. Patient disclosed physical abuse by father, including burning with cigarettes, hitting, pushing. Father is in waiting room. We've called for police response." Dr. Lee's expression hardened. "Understood. Good catch, Jake. I'll take it from here." 2 Denver police officers arrived within minutes, followed by Detective Lisa Chen from the Child Abuse Unit. Jake gave them his statement, what he'd observed during assessment, Emma's disclosure in the ambulance, the injuries inconsistent with the father's story. "You did exactly right," Detective Chen told him, separating the child from the parent, getting her disclosure, documenting injuries, calling it in immediately. That's textbook response to suspected abuse. Detective Chen went to interview Emma with a specialized forensic interviewer, while Dr. Lee examined her thoroughly and documented all injuries. Meanwhile, Brian Foster was growing increasingly agitated in the waiting room, demanding to see his daughter. Finally, Detective Chen approached him. "Mr. Foster, I'm Detective Chen with Denver PD Child Abuse Unit. I need to speak with you about your daughter's injuries." Brian's face went from concerned father to hostile immediately. "What? Why?" "She fell down the stairs. I told the paramedics what happened. Your daughter's injuries are inconsistent with a fall downstairs. We have concerns about how she was injured. I need you to come with me for questioning." "This is ridiculous. I'm not going anywhere. I want to see my daughter." "You can't keep me from my daughter. Mr. Foster, your daughter has been taken into protective custody based on credible disclosure of abuse and medical evidence of ongoing physical abuse. You can come willingly for questioning, or I can arrest you right now. Your choice." Brian's mask slipped completely. "That little bitch told you lies, didn't she? After everything I've done for her, I should have." He stopped himself, but too late. Detective Chen had heard enough. "Brian Foster, you're under arrest for child abuse. You have the right to remain silent." Brian was handcuffed and removed from the hospital, shouting threats and denials the entire way. Jake watched through the trauma bay window, feeling both relief that Emma was safe and anger at what she'd endured. How long had this been happening? Why hadn't anyone noticed before? Detective Chen's investigation revealed horrific ongoing abuse that had lasted Emma's entire life. Medical records showed Emma had been brought to emergency rooms 7 times over 7 years with various injuries, broken bones, burns, lacerations. Each time, Brian had provided explanations. She fell, she touched a hot stove, she ran into something. Each time, doctors had treated the injuries and sent her home. 7 times, Dr. Lee said to Jake later. 7 times this child came to hospitals with injuries, and no one reported it. No one recognized the pattern. Jake felt sick. How did that happen? Different hospitals each time, no one seeing the pattern because there was no central database tracking it. And Brian was smart. He never brought her to the same place twice. No doctor saw the history, but Jake's documentation and Emma's disclosure had broken through that invisibility. Now, with all 7 previous ER visits compiled together, the pattern was undeniable. Emma's mother, Jennifer Foster, was working as a night shift nurse when police contacted her. She rushed to the hospital, devastated and guilt-ridden. "I didn't know," Jennifer sobbed to Detective Chen. "I work nights." Brian said he was taking care of her. When I'd see bruises, he'd say she fell or got hurt playing. I believed him. How could I not see this? How could I not protect my own daughter? Brian was careful, Detective Chen explained gently. He abused Emma only when you weren't home. He threatened Emma that he'd kill you if she told. He manipulated both of you. This isn't your fault, it's his. But Jennifer couldn't forgive herself. I should have seen something. I should have known. I'm a nurse, for God's sake. I see abuse victims at work. How did I miss it in my own daughter? Emma was placed in temporary foster care while the investigation continued, and while Jennifer underwent evaluation to determine if she'd been aware of or complicit in the abuse. The evaluation ultimately concluded Jennifer had been a victim herself of Brian's gaslighting and manipulation and hadn't known about the abuse. Brian Foster was charged with 7 counts of child abuse, assault, and terroristic threats. The evidence was overwhelming. Emma's testimony, Jake's documentation, medical records from 7 ER visits, photographs of injuries, and physical evidence in their home, cigarettes matching the burn patterns on Emma, a closet with a lock on the outside where Brian had locked Emma as punishment.
Brian's defense tried to claim Emma was lying, that she was a troubled child prone to self-harm, that the injuries were accidental, but the medical evidence didn't support any of those claims. The pattern of injuries, the testimony, the forensic evidence, it all pointed to systematic, ongoing abuse by her father. During the trial 6 months later, Emma, now 8 years old and in therapy, testified with remarkable bravery about years of abuse. She described being burned with cigarettes, being pushed downstairs, being locked in closets for hours, being hit and choked, and terrorized. "Daddy said I was bad," Emma told the jury, her small voice clear despite her tears. "He said I deserved to be hurt because I was a mistake, but my therapist says that's not true. She says no child deserves to be hurt. She says it was Daddy who was wrong, not me." The jury deliberated for 3 hours before returning guilty verdicts on all counts. Brian Foster was sentenced to 25 years in prison. At sentencing, Emma provided a victim impact statement that Jake was present to hear. "The paramedic who came to help me when my arm was broken asked me what really happened. I was so scared to tell him, but he promised he'd keep me safe. He promised my daddy wouldn't hurt me anymore. He kept his promise. I'm safe now, and I want other kids who are being hurt to know, if you tell someone, they can help you. You just have to be brave and tell the truth." After the trial, Jake met with Emma and Jennifer. Emma ran to him and hugged him. "Thank you for helping me. Thank you for believing me." Jake knelt to her level, his eyes wet. "Emma, you were so brave. You told me the truth even though you were scared. That took more courage than I've ever seen. I'm so proud of you." Jennifer hugged Jake next. "You saved my daughter's life. If you hadn't recognized something was wrong, if you hadn't gotten her to tell you the truth, if you hadn't reported it, she might be dead. Thank you doesn't feel like enough." "I just did my job," Jake said. "I saw concerning injuries, and I asked questions. That's what we're trained to do." "But you did more than that," Jennifer insisted. "You saw her. You really saw her, and you cared enough to dig deeper. Most of those other 7 ER visits, doctors just treated the injuries and sent her home. You didn't. You recognized abuse, and you acted on it. That's not just doing your job, that's saving a life." Emma's case haunted Jake. He kept thinking about those 7 previous ER visits. 7 times Emma had been brought to hospitals with injuries consistent with abuse. 7 times doctors had treated her and sent her home to her abuser. Jake wasn't a doctor, but he was a paramedic with abuse recognition training. If he'd been able to identify the abuse, why hadn't the ER doctors? He reached out to Dr. Patricia Lee to discuss it. "I keep thinking about those 7 visits. How did no one recognize the pattern?" Dr. Lee sighed. "Lots of reasons. Different hospitals, so no one doctor saw all the visits. Each injury in isolation could be explained as accidental." Brian was charming and gave plausible explanations. Emma was too scared to tell anyone the truth. And honestly, Jake, doctors aren't always trained as well as they should be in recognizing abuse. "What do you mean?" "Medical school teaches us to treat injuries, but specific training in recognizing abuse patterns, in knowing what questions to ask, in understanding trauma responses, that's often minimal or non-existent. I learned it on the job, and through specialized training I sought out myself, but many doctors haven't had that training." Jake was shocked. "So kids can come to ERs with injuries from abuse, and doctors might not recognize it? More often than you'd think. Especially if the abuse is mixed with genuine accidents, if the parent is convincing, if the child is too scared or traumatized to disclose. We need better training." That conversation stayed with Jake. He started researching child abuse statistics and medical recognition rates. What he found was disturbing. An estimated 678,000 children were victims of abuse or neglect in the US annually. Only about 25% of abuse was reported by medical professionals. Studies showed many healthcare providers felt inadequately trained to identify and respond to abuse. Abused children visited healthcare providers multiple times before abuse was identified, if it was identified at all. Jake decided to do something about it. He approached Denver Fire Department leadership about developing enhanced child abuse recognition training for paramedics. His proposal was approved, and he spent months working with child abuse experts, pediatricians, and law enforcement to create comprehensive curriculum. The training covered physical indicators of abuse, injury patterns inconsistent with stated mechanisms, injuries in various stages of healing, specific injury types like cigarette burns, behavioral indicators, fear of caregiver, reluctance to go home, age-inappropriate behavior, flinching or hypervigilance, interview techniques for speaking with children, how to ask questions, how to create safe space for disclosure, how to document statements, how to separate child from caregiver, to allow private conversation, documentation protocols, photographs, detailed notes, exact quotes, reporting procedures, when to call law enforcement, how to hand off to hospital, legal obligations, understanding trauma responses, why children might not disclose, why they might protect abusers. Denver Fire Department implemented the training for all paramedics. Within the first year, there was a 43% increase in suspected abuse reports from Denver paramedics, not because abuse had increased, but because it was being recognized more effectively. Jake also partnered with Denver Health to develop similar training for ER physicians and nurses. Dr. Lee championed the program within the hospital system. "We treat injuries all day long," Dr. Lee told her colleagues, "but we're not always thinking about what caused those injuries. This training teaches us to look beyond the immediate injury to patterns and indicators that suggest abuse. That one extra level of scrutiny can save lives. The program, eventually called See the Pattern, Medical Professional Training in Child Abuse Recognition, rolled out across Denver area hospitals and then expanded to other Colorado facilities. Results were striking. Healthcare facilities implementing the training saw average increases of 38% in child abuse reports. Those reports led to investigations, removals of children from dangerous situations, and arrests of abusers. "We're identifying abuse that was previously invisible," Jake told a news reporter covering the program's success. "These kids were always there, always suffering. We just weren't trained to see them. Now we are, and we're getting them help." Emma Foster's recovery was long and difficult. Years of abuse had left deep psychological scars alongside the physical ones. She had nightmares. She had panic attacks. She had trust issues. She struggled in school. She flinched when adults moved suddenly. But she also had support. Her mother, Jennifer, who'd left her nursing job temporarily to focus on Emma's care, a skilled trauma therapist named Dr. Rachel Kim, foster parents who specialized in abused children, and eventually a supportive school environment with teachers trained in trauma-informed education. Dr. Kim worked with Emma using play therapy, art therapy, and trauma-focused cognitive behavioral therapy. Emma experienced ongoing trauma from infancy through age 7. Dr. Kim explained to Jennifer, "That's her entire formative period. The abuse shaped how her brain developed, how she views the world, how she relates to others. Recovery isn't quick or linear. It's going to take years of consistent support and therapy." But Emma was resilient. Children often were. With proper support and safety, Emma slowly began to heal. The nightmares became less frequent. The panic attacks became more manageable. She started trusting again, carefully, tentatively, but genuinely. One significant part of Emma's healing was connecting with Jake Morrison. With Dr. Kim's guidance and approval, Emma asked if she could see Jake again. He visited her at her foster home, bringing a stuffed ambulance toy. "I got this for you," Jake said, handing it to her. "So you can remember that ambulances bring help, that paramedics are safe people." Emma hugged the toy, then hugged Jake. "You're my hero. You saved me." Jake felt tears in his eyes. "You saved yourself, Emma. You were brave enough to tell me the truth. That took more courage than anything I did. But you believed me," Emma said. "Daddy always said no one would believe me if I told. He said everyone would think I was lying. But you believed me right away, because you were telling the truth, and your injuries showed you were telling the truth. I could see it, Emma, and I'm so glad you trusted me enough to tell me." They maintained contact over the years, with Jake becoming a positive male figure in Emma's life, someone who represented safety and protection rather than violence and fear. By age 10, Emma was doing remarkably well. She'd returned to living with her mother, who'd completed parenting classes and therapy, and had been cleared by CPS as a safe caregiver. She was thriving in school. She'd made friends. She still had hard days, but they were outnumbered by good days. "I'm proud of you," Jake told Emma during one of their visits when she was 11. "Look at how far you've come. You're strong and brave, and you're building a good life." "I'm proud of me too," Emma said, smiling. Dr. Kim says that's okay, to be proud of surviving and healing. She says I'm a survivor, not a victim. Dr. Kim is right. You're absolutely a survivor. Emma looked at Jake seriously. "I want to help other kids. When I grow up, I want to help kids who are being hurt like I was. Can I do that?" "You can do anything you set your mind to, Emma, and I think you'd be amazing at helping other kids." 5 years after Jake saved Emma, his training program had expanded far beyond Denver. See the Pattern was now implemented in 7 states, training thousands of paramedics, EMTs, ER physicians, nurses, and other healthcare professionals in child abuse recognition. Jake had become a national voice on the issue, speaking at medical conferences and training sessions about the importance of healthcare providers recognizing and reporting abuse. "Emma came to emergency rooms 7 times before I encountered her," Jake would tell audiences. 7 times healthcare professionals treated her injuries without recognizing a pattern of abuse. "I was the 8th medical professional to see her. I happened to have specialized training in abuse recognition. I happened to ask the right questions. I happened to create a space where she felt safe disclosing. And because of that, her abuse was finally stopped." He'd pause. "But what if I hadn't been trained? What if I just treated her broken arm and sent her home like the previous 7 encounters? How much longer would the abuse have continued? Would Emma have survived? We can't know. But we know this. Healthcare providers are uniquely positioned to identify abuse. We see patients' injuries. We have opportunities to ask questions. We can recognize patterns, but only if we're trained to do so." The statistics supported Jake's message. Research showed that RMAD of throughout 5 healthcare encounters before abuse was identified. Healthcare providers who completed specialized training were 3 to 4 times more likely to recognize and report abuse. Early identification significantly improved outcomes for victims. Many child abuse deaths involved children who'd had recent healthcare encounters where abuse indicators were missed. "We're literally talking about saving lives," Jake emphasized. "Not every abused child will disclose like Emma did, but many will give us signs if we know what to look for. Injuries that don't match the story. Patterns of repeated injuries. Fear around caregivers. Behavioral indicators. If we're trained to recognize these signs, we can intervene before abuse escalates to fatality. Jake also worked to address one of the major barriers to reporting: fear of being wrong. Medical professionals often hesitate to report suspected abuse because they worry about being wrong, about causing trouble for innocent families, Jake explained in training sessions. But here's the thing: you're not investigators, you're not judges. Your role is to recognize concerning signs and report them. Then trained investigators determine if abuse is actually occurring. You're not required to be certain, you're required to report reasonable suspicions. Err on the side of protecting children. He'd share examples of providers who'd been reluctant to report, whose suspicions turned out to be correct, and whose delays in reporting resulted in continued abuse or even fatalities. The cost of a mistaken report is some temporary discomfort for a family and an investigation that clears them. The cost of not reporting when your suspicions are correct is a child continuing to suffer or dying. Choose to protect children. Jake's work inspired others in emergency medical services to develop specialized expertise in vulnerable population protection. Paramedics across the country created training programs for recognizing elder abuse, domestic violence, trafficking, and other hidden crimes that medical professionals might encounter. Maria Santos, Jake's former partner, developed a program specifically for recognizing domestic violence indicators during medical calls. "We go into homes regularly," Maria explained. "We see relationship dynamics. We see injuries. We hear things. But we're not always trained to recognize abuse patterns. Just like Jake's program trains us to see child abuse, my program trains us to see domestic violence and to respond in ways that protect victims." Another Denver paramedic, James Chen, created training on recognizing human trafficking. "We respond to overdoses, assaults, medical emergencies, and sometimes the victims are trafficking victims, but we don't realize it. If we're trained to ask the right questions and recognize the signs, we can identify trafficking situations and connect victims with help." Together, these programs transformed how emergency medical services thought about their role. EMS wasn't just about treating immediate medical emergencies, it was about seeing the whole person, recognizing hidden dangers, and connecting vulnerable people with protective resources. "We're often the first outside eyes in people's homes," Jake told a conference of EMS leaders. "We see things family, friends, neighbors don't see. We have opportunities to identify abuse, violence, exploitation, but only if we're trained to recognize it. And only if we understand it's part of our job to protect vulnerable people, not just treat their immediate injuries." The culture shift within EMS was profound. What had once been narrowly focused on immediate medical care expanded to include holistic assessment of patients' safety and well-being. Paramedics became partners with law enforcement and social services in identifying and protecting vulnerable populations. "Jake Morrison changed our profession," said Thomas Anderson, president of the National Association of EMTs. "He showed us that our role extends beyond bandaging wounds to understanding what caused those wounds and ensuring patients are safe when we leave them. That's transformative."
But the work wasn't without controversy. Some medical professionals and civil liberties advocates worried that training healthcare providers to scrutinize families for abuse indicators created a surveillance culture that disproportionately affected poor and minority families. Mandatory reporting laws and heightened suspicion of abuse fall most heavily on poor families and families of color, argued Dr. Sandra Williams, a family physician and civil rights advocate. Middle-class white families get the benefit of the doubt. Poor Black and Hispanic families get reported to CPS for things like inadequate housing or financial struggles that aren't actually abuse. This training, while well-intentioned, risks amplifying those disparities. Jake took these criticisms seriously. He worked with civil rights organizations and community advocates to refine the training to address bias and ensure focus remained on actual abuse indicators rather than poverty indicators. "Poverty is not abuse," Jake emphasized in updated training materials. "A child living in inadequate housing because the family is poor is not being abused. They're living in poverty, which is a societal failure, not a parenting failure, but a child with unexplained injuries, who shows fear of caregivers, who discloses abuse, that requires reporting regardless of the family's income or race. We need to distinguish between indicators of abuse versus indicators of poverty or cultural differences." The training incorporated explicit instruction on avoiding bias. Don't assume abuse based on family demographics. Don't confuse poverty with neglect. Understand cultural differences in discipline and caregiving. Focus on objective indicators, injuries, fear disclosures, not subjective judgments about lifestyle. Recognize your own biases and actively work against them. Ensure equitable treatment regardless of race, income, or family structure. Jake also advocated for better resources to support struggling families before problems escalated to abuse. If we're identifying families in crisis, we should be connecting them with support services, food assistance, housing help, mental health resources, parenting support. Prevention is better than intervention. These refinements didn't satisfy all critics, but they did address many concerns. The program became more nuanced, more aware of systemic issues, more focused on genuinely protecting children rather than surveilling families. The work took an emotional toll on Jake that wasn't visible in the success statistics and expanded programs. He'd spent years immersed in child abuse cases, training, speaking, consulting, reviewing cases. The constant exposure to children's suffering wore on him. "I can't unsee what I've seen," Jake told his therapist, Dr. Robert Martinez. "Every training session, I review case studies. Every case involves a child who was hurt by the person supposed to protect them. I carry all of their stories. Emma's story, every other child's story. It's heavy, Dr. Martinez. It's so heavy." Dr. Martinez helped Jake understand he was experiencing vicarious trauma, the cumulative emotional impact of working with trauma victims and hearing their stories repeatedly. "You're absorbing the pain of hundreds of abused children. That would affect anyone. You need better boundaries and self-care strategies." Jake started setting limits. He reduced his speaking schedule. He took breaks from training work to focus on regular paramedic shifts where most calls weren't abuse-related. He engaged in hobbies unrelated to work, hiking, photography, spending time with friends who didn't work in emergency services. "I can't save every abused child," Jake told Dr. Martinez. "I can train people to recognize abuse. I can respond when I encounter it, but I can't personally rescue every suffering child." Accepting that limitation is hard but necessary. He also leaned on his partner, Rachel, a teacher he'd been dating for 3 years. She understood the importance of his work, but also recognized when he needed to step back. "You've built something incredible," Rachel told him during a particularly difficult week when Jake was struggling. "You've trained thousands of people. You've changed systems. You've saved lives. But you can't pour from an empty cup. You need to take care of yourself so you can continue doing this work sustainably." Jake took a 3-month sabbatical from training and speaking, focusing on his regular paramedic work and personal life. He hiked Colorado trails, took a photography class, traveled with Rachel, reconnected with friends. He returned to the advocacy work, renewed and with better boundaries. "I learned I can be passionate about this work without letting it consume me," Jake told a mentor. "I can care deeply while also protecting my own mental health. That balance is necessary for long-term sustainability." When Emma turned 16, she made a decision. She wanted to share her story publicly. She wanted to use her experience to help other abused children and to support Jake's advocacy work. With her therapist's support and her mother's permission, Emma wrote an article for Teen Vogue titled "The Paramedic Who Saved My Life by Asking One Question." The article told her story: years of abuse by her father, 7 ER visits where no one recognized abuse, Jake's intervention when she was 7, her disclosure in the ambulance, her rescue and recovery. "When Jake asked me what really happened to my arm, I was so scared," Emma wrote. "My father had told me my entire life that if I ever told anyone what he did to me, no one would believe me. He said I'd get in trouble for lying. He said he'd hurt my mom, but Jake promised he'd keep me safe. And I decided to be brave. I told him the truth, and he kept his promise. He saved me." Emma's article went viral. Thousands of abuse survivors shared their own stories in the comments. Many thanked Emma for giving them courage to seek help or to speak about their experiences. Emma also began speaking at Jake's training sessions, providing the survivor perspective that made the training deeply personal and impactful. "I want medical professionals to understand what it's like to be the child you're treating," Emma told an audience of 300 ER nurses and physicians. "When I came to those 7 ERs with broken bones, burns, and bruises, I was hoping someone would see past my injuries to my suffering. I wanted someone to ask the questions that would let me tell the truth, but no one did until Jake." She described what it felt like to be a terrified 7-year-old, desperate for help, but too scared to ask for it directly. "My father was always there, watching, controlling what I said. I couldn't tell the truth with him in the room, but if even one of those 7 times, a doctor had separated me from my father and asked me privately what happened, I might have been brave enough to tell. That's what Jake did. He separated me from my dad. He asked gentle questions. He promised I was safe, and that created the space for me to finally tell someone." Emma's presence at training sessions transformed them. Healthcare providers saw not just statistics or case studies, but a real person, articulate, intelligent, thriving, who had suffered years of abuse that medical professionals had missed. It made the training personal and urgent. "When Emma speaks, you can hear a pin drop," Maria Santos observed. "She's living proof of what's at stake. Every provider in that room is thinking, that could have been me who missed her abuse, and I never want to miss the next Emma." Emma's advocacy extended beyond training sessions. She worked with child abuse prevention organizations, supported legislation to improve abuse identification and reporting, and mentored younger abuse survivors. Emma's turned her trauma into purpose. Dr. Kim told Jennifer during a therapy check-in. That's a sign of profound healing. She's integrated her experience into her identity in a healthy way. It's part of who she is, but it doesn't define her entirely. By the time Emma graduated high school at 18, she'd become a recognized voice in child protection advocacy. She'd spoken at dozens of trainings, been interviewed by major media outlets, testified before state legislatures about the need for better abuse identification training, and inspired countless survivors to seek help. "I'm going to study social work in college," Emma told Jake when he attended her graduation. "I want to help abused kids the way people helped me. I want to be the person who sees them, believes them, and protects them." Jake hugged her, overcome with emotion. 11 years ago, you were a terrified little girl with a broken arm whispering the truth to me in an ambulance. Now look at you. You're strong, confident, and you're going to change so many lives. I'm so proud of you, Emma." "I wouldn't be here without you," Emma said. "You gave me my life back. Now I want to use that life to help others." 12 years after Jake saved Emma, their combined advocacy had created significant systemic changes in how healthcare, emergency services, and society approach child abuse. See the pattern. Training was now mandatory in 15 states for all paramedics and EMTs. Another 20 states offered it as continuing education with incentives for completion. Over 75,000 emergency medical services personnel had completed the program. Similar mandatory training for ER physicians and nurses existed in 8 states. The medical community had largely embraced the need for enhanced abuse recognition training, with medical schools incorporating it into curricula and teaching hospitals requiring it for residents. But Jake and Emma pushed for more. They advocated for national standards, for consistent training across all states, for adequate funding of child protective services to handle increased reports, and for support services to help families before abuse occurred. "We've made incredible progress," Jake told a Senate committee hearing on child protection. "Medical professionals are better trained. Reporting rates have increased. More children are being identified and protected. But we still have work to do. Not every state requires this training. Not every provider has access to it. Not every report receives adequate investigation due to understaffing at child protective services. We need federal standards and federal funding to ensure every child in America has the same level of protection." Emma testified alongside him. "I was lucky. I was rescued. But how many children right now are in situations like I was, being seen by healthcare providers who aren't trained to recognize abuse, who aren't asking the questions that would let them disclose, who are being sent home to their abusers? Every day we delay implementing comprehensive abuse recognition training nationwide, more children suffer. We can't accept that." Their testimony contributed to the Child Protection Modernization Act, which provided federal funding for states to implement mandatory abuse recognition training for healthcare providers and emergency services personnel, increased funding for child protective services, and established national reporting standards. The legislation wasn't perfect. Funding was less than advocates wanted. Implementation was phased over 5 years, and some provisions were weakened through compromise. But it represented significant progress. "This law will save lives," Emma said at the signing ceremony. "It will help medical professionals see abused children the way Jake saw me, and it will ensure those children get the help they need. That's what we've been fighting for." 15 years after that Wednesday evening ambulance call, Jake Morrison and Emma Foster were jointly honored with the National Child Protection Award for their work transforming how healthcare providers recognize and respond to child abuse. At the ceremony, Jake was 53, still working as a paramedic but also serving as director of EMS training for the National Child Protection Alliance. Emma was 22, in her senior year of college studying social work. 15 years ago, the award presenter said, Jake Morrison responded to what seemed like a routine pediatric injury call, but Jake's specialized training, careful observation, and willingness to ask difficult questions led to a 7-year-old abuse victim finally being heard and rescued. Jake didn't stop there. He used that experience to create comprehensive training that has been completed by over 100,000 medical professionals and emergency responders, leading to thousands of abused children being identified and protected. The presenter turned to Emma, and Emma Foster, the child Jake saved, transformed her experience into powerful advocacy. Despite enduring years of horrific abuse, Emma has used her voice to educate medical professionals, to inspire other survivors, to influence policy, and to change how society understands and responds to child abuse. Together, Jake and Emma have created a movement that has saved countless lives. After the ceremony, reporters asked the inevitable question, how does it feel to be called heroes? Jake deferred to Emma, who'd become skilled at answering such questions. We're not heroes. Jake was a trained paramedic who did his job well. I was a child who finally found the courage to tell the truth. What we are is committed to ensuring other abused children get the same chance I got.
Every child deserves to be seen, believed, and protected. That's what our work is about. But privately, away from cameras and speeches, Jake and Emma reflected on 15 years of impact. Do you ever think about what would have happened if I hadn't asked you what really happened? Jake asked Emma over dinner after the ceremony. Emma nodded. All the time. I think I would have died. Maybe not that year, but eventually. My father's abuse was escalating. He was getting more violent, more reckless. I think he would have killed me eventually, probably in a rage. But you asked the question that let me tell the truth. And that changed everything. She looked at Jake seriously. You gave me 15 years of life I wouldn't have had. 15 years of healing, growing, learning, advocating. 15 years of having a future. I've graduated high school. I'm about to graduate college. I've helped create change. I've built relationships. I've experienced joy. All because you cared enough to ask one question and to act on my answer. Jake felt tears in his eyes. And you've taken that second chance and used it to protect hundreds of other children. The training programs, the advocacy, the policy changes, they've all led to more children being identified and rescued. Your voice has saved lives, Emma. Our voices, Emma corrected. We did this together. Your training gives medical professionals the tools to recognize abuse. My story gives them the motivation to use those tools. Together we've created something powerful. As Jake approached retirement age and Emma began her professional career, they focused on ensuring their work would continue beyond their direct involvement. Jake developed a Train the Trainer program, certifying instructors who could deliver See the Pattern training without requiring his personal participation in every session. Within 3 years, over 200 certified instructors were teaching the curriculum across the country. I can't personally train every medical professional in America, Jake told his trainees. But you can. Each of you can reach hundreds or thousands of providers. That's how movements scale, through multiplication of effort. Emma worked with several organizations to create survivor leadership programs that supported abuse survivors in becoming advocates and peer mentors. She understood that her voice was powerful partly because she was a survivor, and that other survivors had equally important perspectives to share. Not every survivor wants to be public about their experience, and that's okay, Emma told a group of newer advocates. But for those who do, we need to support them. We need to ensure they have therapy, support systems, boundaries, and realistic expectations. Advocacy work is meaningful, but it can also be re-traumatizing if not approached carefully. The programs Emma helped create provided therapy and mental health support for survivor advocates, training in public speaking and media engagement, education about trauma-informed advocacy, peer support networks, guidance on setting boundaries and practicing self-care, assistance navigating the often complicated dynamics of being public about trauma. These programs created a pipeline of survivor voices contributing to child protection advocacy, some speaking publicly like Emma, others working behind the scenes in policy development, program design, or peer support roles. We need survivors at every level of this work, Emma explained, not just as spokespeople, but as leaders, decision makers, and strategists. Survivors understand the system from the inside. We know what works and what doesn't. Our perspective is valuable beyond just telling our stories. Jake and Emma also continued pushing for more comprehensive approaches to child protection that went beyond just identifying abuse to preventing it. We're getting better at recognizing abuse, Jake told a policy forum, but we also need to prevent abuse from happening in the first place. That means supporting struggling families, providing mental health resources, addressing poverty and housing instability, offering parenting education and support. Prevention is better than intervention. They advocated for universal home visiting programs for new parents, accessible mental health services, economic support for low-income families, substance abuse treatment programs, affordable childcare, parenting education and support groups, community-based family support services. Not every parent who struggles becomes abusive, Emma pointed out, but stress, poverty, mental illness, substance abuse, and lack of support increase risk. If we address those underlying factors, we can prevent some abuse from ever occurring. That's the ultimate goal. 20 years after that ambulance ride, Jake Morrison retired from active paramedic work at age 58. He'd spent 46 years in emergency medical services, starting as an EMT at 18 and working continuously until retirement. His retirement party was attended by hundreds, fellow paramedics, physicians and nurses he'd trained, child protection advocates he'd worked with, survivors he'd helped, and Emma Foster, now 27 and working as a clinical social worker, specializing in child trauma. Jake's career can be divided into before and after, Emma told the crowd during her toast. Before that Wednesday evening 20 years ago when he responded to a call about a little girl with a broken arm. And after, when he took that one experience and transformed it into a national movement that has protected thousands of children. She looked at Jake with tears in her eyes. I'm one of thousands Jake has saved, directly or indirectly. But I'm the luckiest one because I got to know him. Because he's been in my life for 20 years. Because he's been mentor, friend, and hero. Jake, you gave me my life, thank you for everything. Jake struggled to compose himself as he addressed the crowd. I've responded to thousands of calls over 46 years. Most were routine: treat injuries, transport to hospitals, go back in service. But some calls change you. Emma's call changed me. It opened my eyes to how much healthcare providers can miss if we're not specifically trained to see it. It showed me that our role extends beyond treating immediate injuries to ensuring patients are safe when we leave them. He looked at the audience of medical professionals and advocates. Every one of you has the power Jake Morrison had 20 years ago. The power to notice. The power to ask questions. The power to believe a child who finally finds the courage to tell the truth. The power to act and get them help. Use that power. Pay attention to the children you treat. Ask the questions that create space for disclosure. Report your concerns. You might save a life. Jake paused. Emma says I saved her. But she saved herself by being brave enough to tell me the truth. And then she saved hundreds of other children by using her voice to change systems. That's the real hero story here. Not me making one phone call, but Emma taking her second chance at life and using it to protect others. After retirement, Jake stayed involved in advocacy work, but at a reduced pace. He enjoyed his grandchildren, traveled with Rachel, they'd married 5 years earlier, and pursued hobbies he'd neglected during his intensive advocacy years. But he never forgot the children. Every training session he still occasionally gave, every speech he made, every consultation he provided, all of it was motivated by the memory of 7-year-old Emma whispering her terrible truth in the back of his ambulance. I think about her all the time, Jake told Rachel one evening. Not just Emma, but all the children suffering right now, who are hoping someone will notice, hoping someone will care, hoping someone will ask the questions that let them tell the truth. I spent 20 years trying to create systems so more of those children get noticed. But I know there are still so many being missed. You can't save them all, Rachel reminded him gently. But you've saved thousands. You've trained people who've saved thousands more. You've changed systems that will continue saving children long after you're gone. That's legacy, Jake. That's what one person paying attention can become. Emma Foster thrived in her career as a clinical social worker. She specialized in working with child abuse and trauma survivors, bringing both professional training and lived experience to her work. I understand my clients in ways therapists who haven't experienced trauma can't, Emma told a colleague. I know what it feels like to be trapped in abuse, to be terrified, to feel hopeless. I know what it's like to be rescued and to face the long, difficult path of healing. That gives me credibility with clients. They know I truly understand. But Emma was careful to maintain professional boundaries and to not let her personal experience overshadow her professional judgment. My experience informs my work, but it doesn't define it, Emma explained. Every client's experience is unique. I can't assume my journey is their journey. I use my experience to build empathy and understanding, but I still listen to each client individually and treat their unique needs. Emma's colleagues noted her exceptional skill in working with the most traumatized, most challenging clients, children who'd suffered severe abuse, who struggled to trust, who acted out their trauma in destructive ways. Emma had patience, understanding, and strategies that came from both her training and her personal experience. Emma can reach kids other therapists struggle with, said Dr. Jennifer Martinez, clinical director at the trauma center where Emma worked. She has this way of creating safety and trust that helps deeply traumatized children begin to open up. It's part professional skill and part personal understanding. She's a gift to this field. Emma also continued her advocacy work alongside her clinical practice. She served on boards of child protection organizations, consulted on policy development, provided training on survivor perspectives, and mentored other survivors entering advocacy or clinical work. I'm living the life Jake gave me, Emma told an interviewer for a child welfare journal. A life where I'm safe, where I'm thriving, where I'm using my experience to help others. That's the best possible outcome from surviving abuse, taking that pain and transforming it into purpose. At age 30, Emma published a book titled Whispered Truth, A Survivor's Guide to Healing and Using Your Voice. The book combined memoir with practical guidance for abuse survivors, navigating recovery, and considering advocacy work. Not every survivor needs to become an advocate, Emma wrote in the introduction. Your first responsibility is to yourself, to heal, to build a good life, to find peace. Advocacy is optional, but for those who feel called to it, who want to use their experience to help others, this book offers guidance on doing that in healthy, sustainable ways. The book became required reading in many survivor support programs and advocacy training curricula. Emma donated all proceeds to child protection organizations.
25 years after Jake saved her, Emma Foster stood in front of a training session of Denver Fire Department paramedics, preparing to share her story with the newest generation of emergency responders. Jake sat in the audience, now 63, retired but still occasionally attending trainings as an advisor and mentor. He watched Emma with pride and emotion. 25 years ago, Emma began. I was 7 years old and being severely abused by my father. I'd been to 7 different emergency rooms with injuries from abuse, broken bones, burns, bruises. 7 times, medical professionals treated my injuries and sent me home to my abuser. No one recognized the pattern. No one asked the questions that would have let me tell the truth. She clicked to a photo of herself at age 7, taken by police after her rescue. The image showed a tiny, terrified child with visible injuries and haunted eyes. The paramedics in the audience visibly reacted. Then I came through this fire department system. Paramedic Jake Morrison responded to a call about a little girl with a broken arm. But Jake didn't just treat my arm. He noticed my other injuries. He noticed how scared I was. He separated me from my father, and he asked me what really happened. That question, what really happened, saved my life. Emma told the story of disclosing in the ambulance, of Jake believing her immediately, of being rescued and beginning the long journey of recovery. I want you to understand something, Emma said, her voice intense. I'm alive and standing here today because one paramedic was trained to recognize abuse indicators and had the courage to act on what he saw. Without Jake's intervention, I likely would have died. My father's abuse was escalating. I was getting weaker. I was losing hope. Jake's question came at exactly the right time. She looked at the room full of paramedics. You have that same power. Every call you run, every patient you treat, you might be encountering an abused child. You might be the only person positioned to recognize their suffering and get them help, but only if you're trained to see the signs. Only if you're willing to ask the hard questions. Only if you understand it's part of your job to protect vulnerable people, not just treat their immediate injuries. Emma clicked through slides showing abuse indicators, interview techniques, and reporting protocols. This training might save a child's life. Take it seriously. Pay attention. Trust your instincts. And when you encounter a child who seems like they're suffering, ask the questions. Create the space for them to tell you the truth. Believe them. Protect them. After the presentation, young paramedics approached Emma, wanting to know more about her experience, asking questions about how to recognize abuse, sharing their own concerns about cases they'd encountered. One young paramedic, barely 22, approached with tears in her eyes. I was abused as a kid too. I became a paramedic because I wanted to help people the way I wish someone had helped me. Hearing your story, it reminds me why this work matters. Thank you. Emma hugged her. Use your experience. Let it make you more observant, more compassionate, more willing to act when you see concerning signs. You understand in ways others can't. That's powerful. After the training, Jake and Emma went for coffee together, a tradition they'd maintained over 25 years of friendship. You've come so far, Jake said, still emotional from hearing Emma's presentation. From that terrified 7-year-old to this confident, articulate advocate and clinician, you've taken your trauma and transformed it into something that helps thousands of people. Emma smiled. I had a lot of help. You saved me. My therapist healed me. My mom supported me. But I think what I'm most proud of is that I didn't let what happened to me define my entire life. Yes, it's part of who I am. Yes, it influences my work. But I'm also just Emma, someone who loves hiking and reading and trying new restaurants and spending time with friends. The abuse doesn't own me anymore. That's profound healing, Jake observed. It is. And it took 25 years. Recovery isn't fast or linear, but it's possible. That's what I want other survivors to know. It's possible to build a good life after abuse. It's possible to heal. It's possible to integrate your trauma into your identity without letting it consume you. They sat in comfortable silence for a moment. Two people bound together by one terrifying night, 25 years ago, and by decades of friendship and shared purpose since. Thank you, Emma said quietly, for everything, for saving me, for believing me, for supporting my recovery, for encouraging my advocacy, for being in my life all these years. You've been so much more than the paramedic who rescued me. You've been mentor, friend, family. Jake felt tears in his eyes. Thank you for being brave enough to tell me the truth that night, for surviving, for using your second chance to help others, for being the extraordinary person you've become. I'm honored to know you, Emma. Jake Morrison passed away peacefully at age 71, 8 years after his retirement. His obituary noted his 46 years in emergency medical services and his transformative work creating child abuse recognition training that had protected thousands of children. His memorial service was attended by hundreds, fellow paramedics, healthcare providers he'd trained, advocates he'd worked with, survivors he'd helped, and Emma Foster, now 35 and a clinical director at a major trauma center. Emma gave the eulogy, her voice steady despite her grief. 28 years ago, Jake Morrison responded to a call about a 7-year-old girl with a broken arm. He could have just treated the injury and moved on, but Jake noticed things others had missed. He asked questions that created space for truth. He believed a terrified child who finally found courage to disclose years of abuse. That one call, That one moment of paying attention saved my life. She looked at the crowd, but Jake didn't stop there. He took that experience and asked, how many other children are being missed? How many are suffering because medical professionals aren't trained to recognize abuse? And he spent the rest of his career answering those questions. He created training that has been completed by over 200,000 emergency responders and healthcare providers. That training has directly led to thousands of abused children being identified and rescued. Emma's voice grew emotional. I'm one of thousands Jake saved, but I'm the luckiest because I got to know him for 28 years, because he was there for my 8th birthday, and my high school graduation, and my college graduation, and my wedding, because he became family, because he showed me through his actions what one person caring enough to act can accomplish. She paused. Jake would want me to tell you this. Every one of you has the power he had, the power to notice suffering, the power to ask questions, the power to believe victims and get them help. Use that power. Pay attention. Act. You might save a life, and that life might belong to someone who goes on to save many others. That's legacy. That's what Jake created. After the service, survivors whose rescues had been connected to Jake's training, either because he'd personally saved them or because responders trained in his methods had identified their abuse, gathered to share memories. I was 12 when a paramedic who'd taken Jake's training recognized that my sports injuries were actually abuse, said Michael Chen, now 28. That paramedic asked the right questions, reported concerns, and I was removed from my abusive home. I'm alive because Jake trained someone to see what others had missed. Similar stories were shared by dozens of survivors. Jake's training had created a ripple effect across decades, with each trained responder potentially saving multiple lives over their career. Emma established the Jake Morrison Memorial Fund to continue supporting child abuse recognition training and to provide scholarships for survivors pursuing careers in child protection, emergency services, or clinical work with traumatized children. Jake gave me my life and my career, Emma told donors at the fund's launch. Now we're going to ensure his work continues indefinitely. Every paramedic trained through this fund, every survivor supported in pursuing protective careers, every child saved because a responder noticed abuse, that's Jake's legacy living on. The fund raised over $2 million in its first year, allowing expansion of training programs and support for survivor leaders entering the field. Emma continued her clinical work and advocacy, now carrying forward the mission she and Jake had built together. She trained new generations of medical professionals, supported survivors in their recovery and advocacy journeys, and worked to improve systems for identifying and protecting abused children. At age 40, Emma reflected on 33 years since Jake had saved her. She'd built a remarkable life, a successful career helping traumatized children, a happy marriage, close friendships, a sense of purpose and meaning. I shouldn't be here, Emma told a group of young survivors she was mentoring. Statistically, I should have died in that abusive home. But I was saved because one paramedic paid attention and acted, and I've spent 33 years since then living the life Jake gave me, a life dedicated to ensuring other children get the same chance I got. She looked at the young people in front of her, all survivors working toward their own healing and considering advocacy work. Jake taught me that one person paying attention can change everything. He paid attention to me. Now I pay attention to the children I treat clinically and the survivors I mentor. You can pay attention too, to yourselves as you heal, to other survivors who need support, to the vulnerable children you might encounter. That attention, that caring, that willingness to act, that's how we protect people. That's how we honor the people who saved us. One of the young survivors asked, "Do you still think about that night in the ambulance, when you told Jake what was really happening?" Emma nodded. Every day. That moment changed my life completely. I was 7 years old, terrified, certain I'd die in that house. Then Jake asked me what really happened, and promised he'd keep me safe. I made a split-second decision to trust him and tell the truth. That decision, combined with Jake's training and willingness to act, gave me everything I have now. So yes, I think about it constantly, and I'm grateful every single day that Jake was the paramedic who responded that night, that he was trained to see abuse, that he cared enough to ask, that he acted on what I told him. She smiled. Jake used to say he wasn't a hero, that he just did his job. But doing your job when it's hard, when it's uncomfortable, when it would be easier to look away, that's heroism. Jake was a hero to me, and to thousands of other children whose lives were saved because of his work. And now it's our responsibility to carry that work forward, to be the people who notice, who ask, who act, who protect vulnerable children the way Jake protected me. 33 years, one ambulance ride, one whispered truth, one paramedic who listened and believed and acted. Thousands of lives changed, a movement created, a legacy that would continue long after Jake Morrison was gone, carried forward by Emma, and by the tens of thousands of medical professionals trained to see children the way Jake had seen Emma.
One person paying attention, one child finding courage to speak, one moment that changed everything. That was enough. More than enough. Everything. This story is dedicated to every paramedic, EMT, emergency room physician, nurse, and healthcare provider who pays attention to the patients they treat, who asks the questions that create space for truth, and who acts to protect vulnerable children. Your vigilance saves lives. And to every child experiencing abuse, you deserve to be safe, you deserve to be believed, and there are people who will help you if you can find the courage to tell someone what's happening. It's not your fault. You deserve better.
Thank you very much for listening. Please let us know what you think of this story in the comments. Don't forget to like the video and subscribe to the channel. Turn on notifications so you don't miss any other videos.